Let's be honest, modern medicine is broken. Patients are dismissed, doctors are exhausted, and mental health care is decades behind. So it's time to disrupt the status quo, to challenge a system that fragments care, dehumanizes patients, and burns out clinicians. I'm Dr. Georgine Nanos, and this is The Kind Revolution, a podcast about breaking old paradigms, rebuilding medicine with compassion and science, and reimagining what healthcare can be when we finally get it right. Because change is here and it's starting with us. Welcome to the revolution. I'm your host, Dr. Georgine Nanos, and today we're diving into a monumental and timely topic: women's health, hormone balance, and what aging strong actually looks like. My fabulous guest today is the incredible Dr. Melinda Silva, MD, a nationally recognized expert in functional and regenerative medicine with nearly 30 years of clinical experience. She is 30. I know. She started when she was 10.
Say it out loud.
She is the CEO and president of Silva MD Anti-Aging and Wellness, and the leading voice in hormone optimization, integrative health, and modern longevity medicine. Also, the graduate of UCLA and UC Davis, and board certified and fellowship trained in integrative and regenerative medicine. Her integrative, evidence based, compassionate approach have earned her numerous accolades, including Physician of the Year, and she's been featured on major platforms like The Doctors and Fox 5 News. She's also the author of Amazon bestseller, Aging Gracefully and Strong. And at 57, she became a multi-title master fitness champion. You've got to see these pictures, people. She is hot. Her dedication to redefining strength, vitality, and confidence at midlife proves that aging is not a decline, it's an evolution. Today's conversation couldn't be more important, coming right on the heels of the FDA removing the black box warning from estrogen, big shift in women's health.
Hallelujah.
I know.
I've been
So we're
waiting
going to
for this.
discuss what that means, clear up common myths about hormones, how to stay strong and balanced and empowered at any age. Melinda, Dr. Silva, welcome, welcome, welcome. I'm
Yeah.
so excited for this.
I'm so excited as well. You know, I could have cried yesterday when I heard the FDA commissioner say that one of the biggest blunders of modern medicine in the last 25 years was withholding hormones for women. And all I could say was hallelujah. I mean, I actually cried because for the last 15 years, I've been trying to champion that same sentiment. And I've been called a quack and what are you doing to your patients? Why are you seeing that doctor? She's trying to give you cancer. All the things, you know, because I was part of mainstream medicine. I left mainstream medicine after 13 years because I loved medicine, but I didn't love the practice of medicine. So I left and I did something that wasn't feasible at the time, doing hormone therapy 15 years ago in an era where everyone believed that hormones cause cancer. My peers would say, "What are you doing? You're such a good doctor. Why are you doing
Yeah.
this?" And I said, "Because I'm a good doctor. I have to do this. It helped me, it changed my life." And I knew that the truth would come out, but I didn't expect it to take so long. So
Yeah.
yesterday, it was just monumental for me when I was hearing the FDA commissioner speak and the other doctors talking about this. And all I can say was, you know, hallelujah, it's about time. And, you know, and for me, it's the same day as usual. I mean, this is what I've been doing. So it's not,
Right.
it hasn't changed the way I practice. It's only validated what I'm doing, and it makes the conversation easier for my patients. And that's what I appreciate, because women don't need any other reason to feel insecure at this age.
Right. I know. I know. It's
Because
so
I will tell
hard.
you,
It's
it is.
so damn
I mean,
hard.
you just, you know, the thing is, when you don't have enough hormones, what I tell women is, when they don't have enough hormones, they don't have resilience, right? You just don't have the capacity, you don't have the bandwidth. And every little thing will set you off because you just don't have everything that you had when you had optimal hormones. So so for me, you know, I have to struggle with some patients still believing that, am I doing something that's safe?
Yeah. And
And
this changes
oh, it changes
everything.
everything. I'm, you know, I just I just kept that recording. I want to blast it out to people. I actually talked about it when I was on Fox L 2 weeks ago. I actually spoke about what the commissioner said in the spring, and I couldn't believe that he actually like announced this yesterday. I was just so amazed
I
because I
know.
actually forecasted that. I said, this
I
is
love
something
it.
that's coming. I know. I can't even believe it. So for me, it's a really big aha moment, and I just hope that more women will, use those facts that they know now, and not, and doctors especially, that they will, really think about what the facts are and not let fear take over when they're talking to patients about hormone therapies. But for me, it's been incredibly life changing and transforming because I started the
Yeah.
hormone therapies when I
Yes.
was 47, 15 years
Tell
ago.
tell us about your story, how you kind of evolved from traditional family medicine, what inspired you to take this path and your own perimenopausal journey.
Well, I was one of those women who were having hormonal changes, and I thought to myself, what I'm going to see my doctor, and my doctor 15 years ago told me that I could take Prozac and birth control pills. That's what we knew. And for
Right.
some reason, I thought because I was a doctor that it was going to be different. I don't know why. And I thought, no, there must be something different. And so on my search to be better, on my search to have um, options, I learned about bioidentical hormone therapies, and it changed my life. It was a time when my teenager, I have 4 kids, and at the time, my teenage son and I were butting heads because he was going through hormonal
You
changes
were
at the same
both.
time I was. So we were like this, and it was just very, there was just a moment when I just broke down. I felt like he slapped me in my face. He didn't, but he said to me, Mama, who are you and what's happening? He didn't recognize me. And I thought to myself, who am I? I don't even know who I am. What is going on?
I love
This
it.
alien just, out of the mouth of babes, right? And he's always been my son that's always challenged me. And I told him, that's going to serve you well one day, but not today with your mom. And of course, he just graduated from UCLA Law School. So I knew that he was going to, he's very,
He's going to challenge
mom,
you and
he's going to
everyone else.
challenge and
Yeah.
everyone else. But it was a awakening, an eye awakening moment for me, because when people that you love don't recognize who you are, that's when you have to do something different. And my husband, I
Yeah.
have a very supportive husband, and he said to me, just do what you need to do to find yourself again, and we'll be here. And I just found that so reassuring and so comforting. I mean, you know, it's no coincidence that a lot of couples separate in their 40s and 50s when people are going through hormonal changes, right? And they're
Yeah.
blaming the partner because they don't understand what's going on with themselves.
Right. And it's
And
happening on
so,
both sides.
on
It's
both
men
sides,
too. Yeah. And I know
and they
you
call
address
it
men too.
menopause because men actually go
Absolutely.
through it as well. But
Yeah.
it's just, but for women, the hormones, it's like falling off a cliff. It's very evident when women don't have enough hormones. With
Right.
men, it's a much slower process, and they just do what I call the grumpy old man syndrome. They just get a little bit grumpy and less tolerant day by day, and you might not be as noticeable. But women, it's, the feelings are also physical, with hot flashes, and some women get no physical symptoms. But I also have men who also get hot flashes and they don't know what it is. They feel heated, right, physically, and they don't know what it is. And so it's interesting because now we're going into this era, and I understood why mainstream medicine couldn't treat that condition, because menopause is not a disease state, right? It's a transition of life. And we didn't know how to treat these transitions of life. And so for me, what I was doing in mainstream medicine was not acceptable, not only for myself, but for my patients. So when I found out the truth, that's when I left. But it was hard, right? Because
Yeah.
in San Diego, over 90% is insurance based, and I was doing a cash only practice. And so that was very scary for me to do that. But I realized that if I was going to be true to myself and true to how I wanted to treat patients, this is the way that I was going to do it. And And I'm just, I look back from that 15 years ago. So I've been doing it for 15 years. So this year I'm 62.
Looking not a day over 32,
And
girl.
I embrace my age because I want people to look at what does someone over 60 look like? What should they look like? I want to change society's
Yeah.
idea of that. So for me, I say out loud, I say that because I want people to say, wow, okay, you can stay strong after 60. And that's what I'm trying to do.
Yeah.
So,
Talk a little bit about, I mean, let's we'll talk about I want to talk about the study, the Women's Health Initiative. I think it's important for our listeners to know like this all of this these decisions that really impacted women's lives for 20 years were based on a flawed study that was not adequately reviewed, and it was based on study participants who were much older. It just didn't apply, and we mistakenly extrapolated it to a much younger population and got wrong information. Nobody really, I mean, cared to do anything to look deeply at it, and I think that is part of the systemic issues in our healthcare system that don't really shine a light on women's health and these kinds of things. What's your take on that?
well, it's really hard for me to say this, but it really talks about the systemic sexism in our country
Hmm.
is what it's talking about.
Yes,
It's
that's
it's a
exactly
it's
what
a
I'm saying.
it's a reflection of that, and women have always been dismissed with their symptoms. Now, I graduated medical school till 1993, and it wasn't until that year that they included women and minorities in research. Can you believe that?
Yeah, no, I
All
know.
the research have been focused on men. Not until the 90s, when I actually graduated from medical school, did they actually include women in research. And
Yeah.
so
And not
it's
just
just
men,
appalling to me. It's just,
middle-aged white
well,
men.
yeah, it's
So
just a
not even
certain
minorities. Yeah,
segment.
it's
So they changed, and they said we're going to do research encompassing, but it really speaks to how society allowed women to suffer. 15 years ago, if I asked my younger self, what do we have for women for menopause? That's what I knew. Prozac and birth control pills, because we were treating symptoms, right? Which
yeah.
it's true that mood changes happen because estrogen and testosterone really affect the neurotransmitters, that are responsible for mood. So when that fluctuates, you have mood changes. So instead of looking at the underlying problem, which I do now, they looked at what are the symptoms and what can we do. So we would give them, the Prozac for the mood changes, the Ambien for sleep issues, Adderall for distractibility and energy. I can't believe how many people are treated for adult onset hyperactivity. I don't believe what they have is lack of focus and energy
Yeah.
because they don't have enough hormones, right? It's
Yeah.
not that they all of a sudden became ADHD, right?
I know.
So
I
there's
agree with
it,
that.
it just it just kills me. So in mainstream medicine, we're looking at symptoms of a disease process, and we're not looking at the foundational problem and the issue. And really, society didn't really care that women suffered. It was a rite of passage. Even I would talk
Well,
to my
yeah,
patients, and my patients will tell me, "Well, the doctor told me it's okay if you don't have sex." I'm like, "No, it's not okay. You're only 50 years old
yeah,
because you're dry down there and you don't want to have sex. That's a different conversation."
exactly.
So I
Exactly.
tell women, but all for so many years we just dismissed women's symptoms. Medicine, there was a gaslighting syndrome that happened with women because they didn't know how to treat them. So instead of looking at for answers, they just dismissed them.
Yeah.
So for
And women were afraid to
yes,
advocate, and we
they
were
were afraid
afraid.
to advocate.
Yeah.
So for me, I want women to have an informed choice. So what that means is that I want to empower them with the knowledge, and then they get to still decide. You get to decide what
Yeah.
treatment you want to do, because it's important that you know that. But now you have a choice. You should have that choice, is what I'm saying. It shouldn't be, I don't want you to take that or I don't know how to treat you. If a doctor doesn't know how to treat you, you should see a different doctor, basically.
I say that all the time. I
And
say
and the
that all the
doctors, and
time.
I say, don't get upset with your doctor because they don't know how to treat you. They just don't have the training. They're doing the best that they can,
Yes,
okay, with the information that they know. But you know what you know, but you don't know what you don't know. So if they didn't get extra training, because we didn't learn about this in medical school, right? I mentor medical students and I ask them how many days of menopause care do they get? You know what they say? Zero, a big fat zero. Okay, so how can you take care of women? How can you take care of patients if you didn't know how to do that? So
right.
I do this because you, like you, we did extra training. I did
Yeah.
2 years after I
Yep.
was a practicing doctor for 13 years. I
Right.
did a 2 year fellowship trying to understand hormones. And it's not just a weekend course that some people
Right.
may take because it's very complicated. You still have to understand physiology, you have to understand endocrinology, you have to understand pathways, and you really have to understand the clinical symptomology that so many women can present with that may not be what you think it is. And everything, and all mood changes are not hormonal. Some people
Yeah.
have real psychiatric issues. So you
Yeah.
have to be able to understand what pathology is and what's not, being trained properly. It's not just by going to a doctor or
Right.
somebody who had a weekend course and
And
say,
I
because
think that's a very important point that we need to
yes.
really stop and focus on because right now, menopause is a hot topic. You've got menopause specialists coming out of the woodwork who are not physicians, who are not trained, who like
Yes.
literally are health coaches giving menopause advice. And that
I,
I had someone who was a personal trainer tell me that they're a menopause coach and I'm like, "What?"
what the heck? And they're doing
So
integrated medicine
yes,
without a
yes.
degree.
Without a license, it's so
I, s-
dangerous.
I mean, even on my Facebook, it came up. Oh, do you want to know how to give functional medicine treatments? Take this 6 week course, and you don't have to have any credentials. Are
I
you
know.
kidding me?
I know. I
It's
know.
just,
It's really
it's
scary.
just
So
crazy. But it's gonna be hard because people are gonna be desperate.
they
They're gonna be
are.
desperate, and people are gonna monetize on people that are desperate. But we have to tell the audience, Georgine, you need to tell Dr. Nanos, these people, to look at people's credentials.
Yes, yes. This is
Please.
very important. So everyone who calls themselves a doctor is not necessarily
They're
a
not an
physician.
MD.
They're not an MD. Dr.
Yes.
Silva and I are MDs. We did 13 years of medical training,
Yes.
a lot of school.
A lot of
Plus,
slow.
plus we've probably in the course of our careers seen 100,000 patients. I did this
Thousands and
calculation.
thousands of patients. I can't
No,
even tell
I
you.
calculated I've probably seen 100,000
Yes,
people. That's a lot of data
it's a lot.
points. So,
A lot of clinical experience. And I'm
yeah,
scared because there's a lot of people who are going to think that they can be functional coaches and that
yeah,
they're going to be able to give integrative therapies, and
yes.
there's going to be people that are going to get hurt because of it. And I feel
No, I know.
that is that's how how we navigate that is going to be really important in the next coming years.
Yeah.
Yeah.
And that's why I have this platform because I want to
Yes.
help people break down what they hear, the myths, what's out there on social media with real science and make it simple for people to understand. And not to knock naturopaths and other people who want to help.
No, they're wonderful.
But I think you have to work in combination with people who have true vast clinical experience and are true professionals. And I think you have to seek that out. It's very important for the general public to understand that because there is a lot of harm that can potentially be done. So let's talk about what it looks like when a woman comes to see you, Dr. Silva, and she's like melting down in midlife.
Yeah.
What, as many do,
literally literally
literally
melting.
melting, melting, melting. What does it look like when she walks through your door? Walk me through it.
Well, I always like to get comprehensive labs on patients, right? I want to get laboratory because I want to this treatment to be as objective as possible. So I get nervous when patients tell me that they've started on hormone therapy, but they haven't had any lab work done. So that's our first warning sign that if someone says that you don't need to have labs done, then that means that they probably don't know how to read them, and they're probably not going to be credentialed or trained in helping you the way that you should be helped. So with a set of labs, I have then an interview with the patient that we conduct that may take 45 minutes to an hour that goes over their medical history and then clinical symptoms that are what we commonly see in menopause or perimenopause, or even just with bad periods, because I see women also with PCOS and women and teenagers who have irregular periods. It's when they have any kind of hormonal fluctuations is when I will see a woman, and even helped women who had a hard time getting pregnant because their cycles weren't normalized, or they didn't have enough progesterone, for example, or something to keep a pregnancy. They could get pregnant, but they couldn't keep a pregnancy. There's just so many things that could happen in a woman's history. So we take a thorough history, which may take, 45 minutes to an hour, and have a conversation with the woman about what certain changes can happen. And then importantly, what they are, have issues with, what is happening to them that they want to be better, right? We want to optimize. This is very personalized care. So
Right.
every patient interaction I have is individualized, personalized, and different, because my patient will dictate what we do for treatment. So it's not a one size fits all. Whenever, and the reason why someone like you, Dr. Nanos, and myself are really good at doing this is because we're family doctors. So we're used to having anybody come into our office, and
Right.
we're not
Bring
intimidated
it.
by that.
No, we can see
Whatever it
anything.
is.
Bring it in.
Yes,
We got
bring
it.
it
We'll
in.
figure it out.
But we're not intimidated by that, right?
That's
Because we
so
have
true. It's
it's
so
because
true.
that's in our DNA. That's what we're trained to do. So we're not intimidated by that. So I feel nervous about someone who's never seen patients, right? Because the
Yeah.
problem with seeing somebody who hasn't seen patients who are sick is that they might not be able to recognize when you're sick. This is the
Right.
very, very important point. Because yes,
Yeah.
most of the patients are going to be well, but
Yep.
there are some patients that are not going to be well.
Yep.
And so if you don't know how to recognize thyroid disorders, for example, or you don't know how to recognize nuances in medicine, this because everything is not hormonal when a woman
Right.
has changes.
Right.
It
Right.
could be
Or
coincidental at the
yeah.
time, but you have to be able to sort it out. Is she having a real heart issues? Is she's having,
Yep.
real issues with her lungs, whatever, but you have to be able to be a good clinician and
Yep.
understand. And because we have experience, because we have taken care of people that are sick, that's the expertise that we bring to the table that other people will
True.
not be able to bring, to recognize when someone is not well.
Yeah.
So, and people have told me, I mean, I've saved people's lives literally because of abnormal lab results
Yep.
that that uncovered something that they didn't know about, or even a heart condition. I had a woman who told me that she ended up having a murmur that I heard that ended up needing surgery that she could have died from, but her primary doctor just didn't catch it. So there's things that we can do to help patients that are just beyond hormones, because we are medical doctors.
Yeah.
You have that distinction as well, and it's very important. So I appreciate the platform that you have to make sure that people recognize that it is not just easy. It's not easy to do this.
No, and there's
You
no
have to have the background,
there's
the
no one
expertise.
size fits all approach, and it kind of makes my team crazy because they're like, don't you have like a protocol? I'm like, no, there is no
No, it
protocol.
depends on what the
Everything is
patient comes
different.
with.
It depends on what's in front of you, and that's really medicine is very much a science, but also that's the
Yeah,
art of it. You have to really think on the fly and work with the patient in front of you and
they call
tailor a
it the
custom
practice, right? They
the
call it the
practice. We're
practice
still
medicine.
practicing because it's different every time, and you have to really have your clinical wits about you
Yes.
to really adjust and figure out what's best for that person in front of you. Let's talk a little bit about the difference between bioidentical hormones and synthetic hormones. What's It's kind of evolved a lot since the early days. Now there
Mhm.
aren't as many synthetic hormones, but I still get asked this question a lot. Like, I only want bioidentical hormones, and I explain
most of them now are. But let's go ahead and talk about that.
Well, for example, I use the plant-based hormones as you do, right? So the bioidentical hormones are made from plants, and they were actually developed in the 1940s. But Big Pharma couldn't make money on it because they can't patent a naturally occurring
Plant.
substance. So
Yeah.
yeah, it's a plant. Bioidentical hormones have been around even before the synthetic hormones, but to monetize on hormone therapy, they took, and I was so appalled when I actually knew this truth because I didn't even know this until
I
I
know what you're
started
gonna say.
practicing. They took the urine of pregnant horses. Premarin is pregnant mare's urine, and that's what
Gross.
Premarin is. And did you know that that was the number one drug in
Yes,
the
yes,
world? The number
yes,
one drug in the world.
yes, yes.
So
So gross.
it's a synthetic, so it's made from the urine of pregnant horses. And literally, when I found out how they harvested the urine, I cried because I didn't realize that they corralled these horses for months and they didn't allow them to move so that they can take the urine. And sometimes the calves would be killed, and it was just horrifying. When I knew that truth, I could not write another prescription
Same.
for Premarin. That happened 15 years ago for me.
Yeah.
So when I knew that truth, I said, I can't do this. So what the bioidentical hormones are, they're made to look chemically like the hormones your body makes. So we're just replacing what nature has lost. And so what you want to do is you need to understand that you want to do this in still physiological doses. So that means you have to understand physiology and you have to understand how the hormones work because all the hormones interplay and affect each other. So when I see, even when I take care of men and I see that they're only checking testosterone, but they're not checking estrogen, that's very dangerous because men who have too much estrogen, they can have issues with heart issues. They could have big bellies that never go away. I mean,
Hmm.
there's things that happen to your body if you don't know what to do or you don't understand the physiology. And so, what the bioidentical hormones are trying to do is just replace physiologically what your body is missing, right? But you
Right.
want to do it from a place of health. So that's why I check levels. A lot of people don't know how to check levels because they don't have the training to do that. So they don't do it. And they just willy nilly and just randomly, start hormone therapy. And it just drives me crazy because I have to fix a lot of those issues
Yeah.
when I see people that haven't been treated correctly. But I tell people that when I see them in the office, like you, we've seen thousands of patients, they get to direct how their treatment is. If something's not working for them, we change it.
Right.
But we know how to change it, right? For,
Right.
for some people, I was horrified. I saw a patient last week and she was horrified because the doctor she saw, she was having symptoms. The hormone therapy wasn't making her feel well. And her doctor just told her to suck it up. If she didn't do what she told her she should do, that she wasn't going to get better. And that's not a true statement. Just
No,
because you take
that
the
makes
hormone
me
therapy,
sad.
I know because she didn't have the patience or maybe the education to change it because they're
Yeah.
just giving everybody the same treatment. So, I told her, no, that's not, when you start this treatment, you shouldn't have worse symptoms. You shouldn't
Right.
feel
Right.
worse.
Yeah. You
And
may
so when
not
you
feel
do,
better like
yeah,
immediately. You may not feel better
right, but you
immediately.
shouldn't
People,
feel worse.
yeah, no, you should
Yes.
definitely not feel worse. That's a big red flag. Let's say that right
If
there.
someone says,
You should
yeah.
not
So,
feel worse.
so,
But
so, so if a doctor you treat tells you that you suck it up, then that means you see a different doctor because they don't know how to treat the symptoms or the side effects because that
absolutely.
means you're not in balance somehow. And
Right.
it just kills me. But I tell you what you said earlier, Dr. Nanos, which is very, very important. We can help the patients because we have that clinical experience. We have the know-how to say, if this doesn't work for you, this is what we're going to do to help you. We can change because we know, because we're comfortable with that. It's not a one size fits all. And that's what I'm afraid of is going to happen because people are going to come out of the woodwork and say that they're menopause specialists because people are going to be desperate. And
I'm
it's not
already
going to,
I already see
it's
it.
just,
It's scaring the crap
it's
out of
just,
me. It's
it's
really
just, and I have people who are not even having any hormonal changes. They might be in their 20s and 30s and they're talking about menopause. I'm like, are you kidding me? You have
I mean,
no, why are you on TikTok talking about menopause and you're like 28 years old?
I
Do
mean,
not do
I
that.
kind
It
of
drives me
love
crazy.
I kind of love that we've shined a big light on it, but it doesn't need to be that big. Well, let's talk one quick thing on menopause, and we're going to move on to aging strong.
Yeah.
Let's talk about just the link with cancer. The idea that estrogen must be balanced with progesterone. That's very, very important for people to know out there. Uh, talk about that real briefly, just to remind
Well,
everyone and the people who think they might be experts. This is the most
yes.
important part.
Well, because it kills me because I will give progesterone is also very important, right? I know that we were talking about estrogen a lot, but progesterone is also a very important hormone for women and very instrumental in helping women to sleep. And one of the things that I want to make sure people understand is that the issue that the question, the most common question that I get from a woman is, I don't have my uterus anymore. Do I still need progesterone? My doctor, my OBGYN told me, no, I don't need progesterone because I don't have my uterus. And it just drives me crazy because there are hundreds of receptors on the body that take on progesterone. I tell them, but you still have your brain, you still have your
Right.
bones, you still have your heart, you still have your breast. Progesterone receptors are all over your body. Yes, you don't have your uterus, but we're not focusing on progesterone for uterine care. We're focusing on progesterone for whole body care. So people have to understand again,
That's an important nuance too.
a
Yeah.
deficit in their education because they don't
Yeah.
understand the importance of balancing all hormones, that it's not just about estrogen. It's also about progesterone and testosterone, also cortisol and thyroid, but it's hard. There's a lot of hormones. Women are a lot, it's very complicated. So people who don't have that experience and they can get very easily intimidated by just pigeonholing all women to this is what your treatment should be, and it's not true. And that's how women can get hurt. So again, I can't stress enough how it's important to look at someone's credentials and make sure that they really know how to take care of you. And I should just do a video on why progesterone is important because talk about it at length and women still look at me like deers in headlights, but my doctors told me I didn't need it, and it drives me crazy. So it's
Well,
just that's just one thing I want to put out there, Dr. Namas, to
yes.
your
No,
audience.
that's really
Just
important.
because you don't have your uterus, you still should be on progesterone, and I will get that all the time. I will get OBGYNs telling me, why do you have her on progesterone? She doesn't have a uterus, but she still has her breasts. Okay, she
Let's
still has her brain.
so
She still has
let's
her bones.
let's just
That
break
drives
down
me crazy.
let's break down why they think that, because so the reason, just for our listeners who don't
Yes,
understand what we're talking about here. So if you have a uterus, you need to balance progesterone, because if you have unopposed estrogen and you still have your uterus, that all of that estrogen without progesterone, to balance it out, can cause endometrial cancer. This is why we
yes,
always put people on progesterone also. So I just want to get that out there.
yes.
But
That's
as Dr. Silva
right.
was saying, we have progesterone supports GABA in our brain. It does so many other things. We should talk about ExoMind and
Yeah,
that as
I
well.
love the exomind, right?
Yes, yes.
And I love that you're in the study. We both Dr. Nanos and I had the privilege of being able to be one of the first sites in the country to offer exomind. And I love that there is a non-prescriptive modality that will help women with sleep and mood issues who don't tolerate the antidepressants, or who want to have a different modality besides prescription drugs. And I love the technology. As you know, you're an expert in cranial magnetic stimulation, and you've been doing it for years, and you've helped thousands of people with it. And I just love how I call the ExoMind TMS 2.0, right? Because it takes it to the next level. It
It really
makes
does.
so much easier because the analysis isn't cumbersome anymore. The treatment isn't cumbersome. It's now, instead of 30 or 40 treatments, we're doing 6 treatments, twice a week for 3 weeks or once a week for 6 weeks. So it's really easier for patients, which makes it a lot more affordable. And it's just another modality that we can use and offer patients that have had issues with sleep and mood. So I love that that's another tool that we have in our toolbox that can help augment the treatments with hormone therapies. And I feel very proud that we can offer that to patients. So
Yeah, it,
my
it
patients love it.
it's such an exciting advancement that helps kind of
Yeah.
round out the whole picture. And also, like you said, gets away from medications and pills and does helps your brain reset naturally. Let's talk about longevity and strength. I know you're the queen of strength. You've won many fitness competitions, even at 62. What inspired you to pursue these challenges? What does your day to day lifestyle look like when it comes to strength training, nutrition, recovery, and like what do you want to tell women who hear about like that? I need to build muscle in midlife, and they're very intimidated.
Well, when I was in school, especially in high school, I was not the pretty one and I was not the athletic one. I was
Shocking
the
to me.
smart one. No, I was the smart one. I was the nerd. I
I was
would,
I was
right?
the
I was the
nerd
nerd.
too.
I
I
was
was
the
the
nerd.
nerd
And
too.
I was, that's what I knew. Something happened to me when I was 57. Okay. I had prediabetes and high blood pressure from my father, right? I'm
Mm,
Filipino, so we're what we call skinny fat. Filipinos actually have the most amount of visceral fat than any Asian. They did MRI studies to show this. So even though I was skinny on the outside, I was fat on the inside. At 57, I was 25 pounds heavier than I am now. And what happened was it was COVID. And a terrible thing happened where I had actually lost my dad.
I'm
And
sorry.
it was a really hard time in my life. I was in a despair that I hadn't known. And my friend, who was a trainer, he said to me, "What's wrong with you? You're not yourself." And I said, "I have no joy." I was in a deep despair and a sadness that was foreign to me, and it was a void. And so he said to me, "We are going to focus on the strength of your body to get you out of your despair. And by the way, you're doing a bikini contest." I said, "Hell no, I'm not doing that." Remember, I was not the athletic one. I didn't even do weights, right? I tried CrossFit and I hurt my wrist, right? Because I didn't do it correctly and whatever. I just whatever, right? And so he says, "No, you're going to do this because I know how goal oriented you are. And I want you to have a goal." So I did. So for 4 months, and it was really hard, Georgine. I mean, it was really hard because I love cookies. Okay. I'm not going to lie. So I never met a cookie that I didn't love. So it was really hard. I'm like, okay, I'm going to have to give up my cookies. What the hell? This is going to kill me. But I knew, and it was really hard. And I have arthritis, okay? Because remember, I'm 57. After 50, most people will have wear and tear arthritis. I had arthritis in my neck, in my fingers, in my wrists, in my knees, in my back. And I was still able to exercise with the right trainer. So the message is you make sure that when you start exercising, that you get the right training, right? That's what I
Yeah.
did. And then the right nutrition was important, right? So cookies wasn't part of my diet. But it was okay because I knew one day I would get back to that, but not for 4 months. And it was really, really tough, but it helped me to really focus on the strength of my body. And with that physical strength, I received that emotional resilience. And it really did help me to motivate other patients because if I could do this at 57, what can
Yeah.
you do, right? So I'm very happy to say just this past weekend in San Diego, I participated in the NPC fit bikini fit model, and look, I won first place
Shocking.
for
Oh
the
my
muscle
God.
contest.
You are such a
Actually,
bad
so
ass. Badass. I'm
and it
so
was
proud of
hard,
you.
and I will tell you, but so every year I didn't even want to do it this year because there was a lot of changes in my life. I'm taking care of my mom. She's still been depressed with my dad passing. It's been 5 years, but it's and I will tell you that I will still hear my dad motivating me. And even when he's gone, he still inspires me because there's some days I don't want to exercise and I don't want to get up. And he used to call me baby, right? Because my God-given name is Baby Melinda, which most people don't know, but my family still calls me baby. And I'd wake, yeah, I lay in bed and I'm thinking, oh my God, I have to get up and I have to train and I don't want to train. And he would poke me. He would say, baby, get up. You can do this. And I would hear him in his little Filipino military voice, get up. You can do this. And I'd be like, oh, daddy. But it would still inspire me, even though he's not here. So I tell people, whatever your inspiration is going to be, whatever that's going to be for you, it might be a child, it might be a mentor, it might be a friend who, is sick and needs and got better because the extras, whatever your inspiration is, lean on that because you will
Yeah.
need it because it's not easy.
Yep.
Now, I mean, I worked really hard for 4 months to lose the 25 pounds. And by the way, I reversed my prediabetes. I don't have. I used to have blood pressure medicine. I don't have that either. So coming from, knowing that this was keeping me healthy, right? Because now I have a grandbaby, and that's what I have a new bucket list. I want to spend time with my grandbaby, but that means I got to stay strong. I got to stay strong. So really, I do the contest every year, and I agree to do it just so that I don't fall off the bus, you know what I mean? Or fall off the
Wagon.
wagon, as they say, right? The wagon. I want to stay healthy. I want to stay strong. I want people to look at how someone after 60 should look like. And it's very empowering to be in this muscle contest and seeing women in their 50s and 60s and they're strong and they're confident, and that's very empowering.
I
So
love
for
that
me,
so
I'm not one of
much.
those, because I'm not one of those women that get intimidated by by someone else's beauty. Like Georgine, you're beautiful all by yourself. Your beauty doesn't take away from my beauty.
Yeah,
And
no,
I
I
love
think
women to be more beautiful, and I don't get intimidated by that. And when women do, it's that insecurity that I'm not sure, that's societal or whatever it comes from, but
that's
it
why I
shouldn't be
love
that
you,
way.
because we're collaborating women. Women need to
Yeah,
bring each
yes.
other up.
We
We need to
want
stick
to, yes.
together. Yes.
And that's our job. We want women to shine. And the thing for me is that when you're healthier, you're always going to look better. So
Yeah.
I always tell people, let's focus on your health. Let's focus on your what you could do to stay stronger. And it doesn't mean you have to be in a bikini contest. It could just mean
Yeah.
that you want to fit into your favorite jeans. You want to
Exactly.
feel comfortable in the clothes that you want to wear. You
Right.
want to be able to carry your grandbaby or even play with your toddler, whatever that is.
I
Because
know.
when you're overweight, you don't have energy. You
Yep.
have fatigue. And
Yes.
that's one of the reasons why I want women to be healthier and to own that and to, you don't have to be in any kind of contest to do that. You could just be, I always tell people when it's you versus you always win.
I like that. I like that.
So I don't have a competition with anyone else except for myself. I
That's
want
great.
people to
That's a
shine,
great. That's a great.
And I just think that, you could find the beauty in so many things and everyone. And for me, being those kind of contests it's not to outshine another woman. It's just to validate my own strengths and my own power. And that's what I want people to understand. I don't do this because I have anything to prove,
Yeah.
because that's not what it's about. But for me, it was a matter of health.
Yeah.
It's a way for me to stay motivated and grounded and not, get back to prediabetes and high blood pressure
Exactly.
because that's in my family, that's in my genes. So
Yeah.
these are the cards I'm dealt with, but what can I do to change it? Because we can have that's a whole different episode, nurture versus nature
We're
and
gonna have more
genetics versus environment.
we're gonna have a lot more episodes. So I
Yeah.
love doing this.
But
Leave us with one empowering message for women today that you want our listeners to know. One sentence. What's the most important thing they could take away from today?
that despite whatever you hear from society or loved ones or even yourself, that you are enough, that you have the power within yourselves to be that person that you want to be, and that you can do these whatever goals that you have. And I want women not to get in their own way because usually you are the one that's the greatest obstacle that you have to overcome.
So true.
And if you
So true.
understand that, you can do anything, maybe even a bikini contest. It's
True.
been such a pleasure. It's been
Thank
such a
you.
pleasure
Thank you, Dr.
to have
Silva.
this conversation with you. And thank you so much for having me. You know, I'm a big fan, Dr. Nanos. You're such a good doctor. And I know that I love how you treat your patients. We're kindred spirits. So I
We
just love
are. We
that
are.
we are, yes. And I thank you for having me on your show. And I know it's a very important message that we need to bring out to people. And thank you so
Yeah,
much
and we're
for
going to
taking
talk a
the
lot
time.
more. This was a wonderful
Yes,
conversation. So, to our listeners, you can follow Dr. Melinda Silva on TikTok, Instagram, YouTube, Facebook at Team Silva MD. And to learn more, go to drmelindasilva.com. If you enjoyed this episode, don't forget to subscribe, leave us a review, share it with everyone you know, because there's lots of good information here. And thank you again. This was
thank
wonderful.
you. Take care. Bye-bye.
Thanks for joining the Kind Revolution. If this gave you something real, hope, perspective, or a fresh way to think about health, please share it, subscribe, and pass it on. Medicine won't change on its own, but together we can reimagine it and build something smarter, kinder, and create a system that truly heals. This is the Kind Revolution with Dr. Nanos, where science meets compassion and the future of medicine gets brighter one conversation at a time. Thanks for joining the revolution.